Welcome back. Aid agencies say time's running out for children in Gaza, with the UN saying 1 in 5 of those children are malnourished. A third Palestinian child has been granted a visa to receive medical treatment here in the UK and arrived last night. Children Not Numbers is an NGO which evacuates children out of Gaza and into Egypt for exactly that reason. Joining me now is a surgeon for Children Not Numbers, Dr. Mubashir Cheema. Thank you so much for joining us, Dr. Cheema. Tell us exactly what you guys do.
Thank you very much for having me. Children Not Numbers, as the name says, it is about putting the children and their interests at the forefront of our priorities. As you understand, that nearly 50% of Gaza is made up of children. And it's not just the injuries that they sustain in the war that has been going on for the last 22 months. It is also the medical conditions that they have, which would still have been there even if there was no war. So, for example, conditions like holes in the heart, kidney problems, children who need dialysis, as well as diabetes patients who need insulin, which in turn needs fridges, which needs electricity, and a whole supply chain. So the idea of starting Children with Numbers beginning of last year was to make sure that these children who are our future are not disadvantaged. Now, the problem is that the number is so much. The health services are on their knees because the hospitals have been targeted. About 1,500 medical professionals have been targeted, and there are no supplies coming in to help these children, which means that there is no way to treat them as well locally. As an organization, our first priority is to upskill the local doctors, to liaise with them on a regular basis as we can with the internet outages and everything, and speak to them to see what we can do or offer help externally to help these children. Secondly, is to educate these children themselves because there are no schools, and to advocate for them. If there are any foreign organizations or foreign missions going into Gaza, we liaise with them and see that, look, some of our children need this or the other treatment or surgery or medicine urgently. Can you please help us? Or is there a specialist with you who can do that? And if at the end of that is not still not possible, for life and limb-threatening injuries, we advocate for a short-term evacuation of these children to neighboring countries, to countries around the world as well. And these have been...
Tell us a bit about that and how easy or hard a process it is that has led to one child, I think I said at the start, arriving in the UK yesterday for treatment.
I think that's one child only. I think still, as in the community of nations, UK stands alone morally as well as with numbers. Hundreds of children have gone into the neighboring countries like Egypt and Jordan. I mean, on top of whatever number of refugees they have been taking previously.
What are the numbers in other European nations?
So France have taken children, as well as Italy, Spain, Romania, and even USA. Probably USA have taken a lot of children outside because many of them, they have needed to be evacuated first time to the neighboring countries and then a second time to other countries as well, because health systems in Egypt and Jordan are not able to cope with them. So they have gone into regional countries like Qatar, UAE, and Turkey. But Europe has taken quite a lot of children, as well as North America.
And what is the hurdle? What is the hurdle here? It's we're saying no?
I think it's lack of action. I think only recently lots of words have been thrown out. But even with the most recent PM's statement, which came out last Friday only, it is at the end of the parliament session. So we've had lots of time, but no action. It's not that we did not know about these children. It's not that we did not know about their injuries, their problems, their medical conditions. And it's not that we were not advocating, or not just Children Not Numbers, other organizations as well. However, the block seems to be somewhere in the Home Office. And we've sussed out between different organizations is that the final say rests with the Home Secretary.
Dr. Mubashir Cheema, thank you so much for joining us.